How is scar tissue removed in hysteroscopy? Scar tissue inside the uterus, often called intrauterine adhesions or Asherman syndrome, can be a significant barrier to fertility. One effective way to remove this scar tissue is through a procedure known as hysteroscopic adhesiolysis. This is a minimally invasive surgical technique that uses a hysteroscope, which is a thin, lighted tube equipped with a camera and surgical instruments. The hysteroscope is inserted through the vagina and cervix into the uterine cavity, allowing the surgeon to see and directly address the scar tissue. The first step in this procedure is visualization. The hysteroscope provides a clear view inside the uterus. To enhance visibility, a sterile fluid is introduced to expand the uterine cavity, making it easier to access the areas affected by scar tissue. Next comes the actual removal of the scar tissue. Specialized instruments are passed through the hysteroscope, enabling the surgeon to carefully cut or dissect the adhesions. There are various techniques for this, including using cold scissors for mechanical cutting or electrosurgical devices that use energy to cut. One method, known as the plowing technique, involves using cold scissors to loosen and remove scar tissue while preserving the healthy uterine lining. After the scar tissue is removed, a temporary device, such as a small plastic catheter or balloon, may be placed inside the uterus. This acts as a physical barrier to keep the uterine walls separated during the healing process, which helps to reduce the risk of new adhesions forming. Hormonal support is often part of the recovery plan. Estrogen therapy may be prescribed after the procedure to promote healing of the endometrium, which is the uterine lining. This helps enhance tissue regeneration and minimizes the chances of scar reformation. Postoperative care is also essential. Antibiotics may be administered to prevent infection, and follow-up evaluations are crucial to monitor how well the uterus is healing and to assess menstrual function. From the perspective of fertility and endometriosis, hysteroscopic removal of scar tissue can restore normal uterine anatomy and improve menstrual regularity. This is particularly important for women who have experienced prior uterine surgeries, infections, or trauma that led to adhesions affecting fertility. It is vital that the surgical technique is performed carefully to avoid damaging healthy endometrial tissue, as excessive injury can negatively impact fertility outcomes. While the risks associated with this procedure are low, they can include bleeding, infection, uterine perforation, and fluid overload. These risks are minimized when experienced surgeons use appropriate surgical methods and intraoperative guidance, such as ultrasound. In summary, scar tissue in the uterus is effectively removed during hysteroscopy through direct visualization and excision using specialized instruments. This is followed by measures to prevent adhesion recurrence and support healing, ultimately improving fertility potential and uterine function. This approach aligns with current medical standards for treating intrauterine adhesions related to fertility challenges and conditions like endometriosis. Always consult with a healthcare professional for personalized medical advice regarding this procedure.